Screen record.
Sige po.
Okay pa. Good day, everyone. Today, we're going to conduct an interview with our guest speaker, Mr. Rex Ladrero Jr., who is a both registered psychometrician and registered psychologist, for us to fully understand intervention in the perspective of a clinical psychologist.
Bago ang lahat, nais ko pong pakilala sa inyo ang aming mga butihing kamag-aral. Ako nga po pala si Danilo Soriano. Siya naman po si Edelyn P. Maramara, Myamy RB Mendoza, James Patrick Taruc, and then Jerome de Vera.
And of course, let's call out the presence of Mr. Rex Labrero Jr. And okay, magsisimula na po kami, sir.
So the first question po, how do you plan an appropriate intervention? How do you plan an appropriate intervention? What are the things to consider when planning it?
Okay, ma'am. Kita naman na.
Sige. Just tell me if naging choppy yung voice ko. So for your first question, how do I plan for an appropriate intervention? Usually, connected naman itong first question ninyo na itong dalawa. You consider kung ano yung
Appropriate.
mga ability, skills, and needs ng client mo. So para magiging appropriate siya, the first thing you want to do is to assess is the amenability of the client. So dapat ma-assess mo kung yung client mo is will respond to, let's say, talk therapy, or kung kunwari, usually kung bata na, let's say, may ADHD, mas gusto nila syempre yung mga interactive na kinds of therapy rather than having someone to talk to. But usually, what else? Things they're like adults can dislike. So, of course, when you're trying to give an intervention, ang first step niya is building rapport. So, you really need to know kung sino yung client mo.
May wala si Sir sana. Let's call out the presence of Mr. Rex Ladrero.
For example, if your client is sporty, siguro you use terms in your intervention na related doon sa mga or kung mahilig siya sa games, mga ganun. Or if student siya, things na nakaka-relate rin siya. Yan.
Okay po. Thank you po. For the next question po.
So for the next question po, how long will you try an intervention before determining whether or not your client is making adequate progress? So repeat ko po yung second question po, sir. How long will you try an intervention before determining whether or not your client is making adequate progress?
So sa intervention, for you to determine if progress, right?
Yes po.
Am I audible?
Medyo ano lang, sir. Medyo...
May close cam na lang, sir.
Okay lang, sir, kahit naka-close cam lang.
Hello?
Hello, sir.
Hello, sir. Medyo lag po sa end.
Determining whether or not your client is making adequate process. So, tama ba? I think I received the right question. So for this question, first of all, you have to understand who. Hello?
Hello, sir. Hello, sir.
Kung ganito, kung naka-off yung aking video, is it still live?
Okay po, sir. Hindi na, sir. Hindi naman gaano pag naka-off yung camera.
Okay. Um, yeah. So for the second question, kasi in developing an intervention, the first thing you would do is, di ba, you're going to create a treatment plan. And sa pag-discuss mo ng treatment plan, you actually also discuss kung ano yung mga measures ninyo to see how, if progress is being made. So doon, in explaining the intervention itself, you're already stating kung ano yung mga markers yan. So when you're trying to do the steps doon sa intervention ninyo, let's say you're having several sessions, in each session you're going to, you can use a rating scale, no, to identify if the progress is there. So instead of saying na, do you this progress, you say na kung kunwari, may sleeping problem, so you try to ask for, are you sleeping earlier than before? Ganun. Or do you have 8 hours of sleep? Ganun. So you try to rate that.
Okay, sir. Thank you po, sir.
Good evening po. For question number 3, what is the most effective
Hello?
treatment? Hello, sir. Do you hear me po?
Yes.
Yes po. For question number 3, what is the most effective treatment plan you develop?
Hello. So, I believe ang next question is what is the most effective treatment plan that I have developed?
Yes
Is that
po.
right?
Yes po.
Yeah, yeah. I can see it on the screen. So for this question, I'm usually using solution-focused brief therapy. So in that case, pag solution-focused, yung treatment plan ko is usually revolves around what they have tried before in dealing with whatever issues they may have, and trying to see uh, how they could refine it to make it better and to target more kung ano yung gusto nilang ito. What you know, dyan ako pinaka-comfortable and mas umaalang dyan yung ang aking values, ang aking perspective. So it's easier to do treatment that is second nature to who I am. At tinitingnan ko kung sasabay yung client with me in that aspect. And then from there, if we're seeing eye to eye sa aming perspective, then yung treatment plan mas naging effective.
Okay, sir.
Okay po, sir. Thank you po. Next question.
So, magandang gabi, sir. Ang aking pangapat na katanungan.
Thank you.
Okay na, sir? Rinig po. Hello, sir? Hello po? No, sir. Rinig na po, sir.
The client.
Hello, sir?
In the same situation and condition if there is, it's more hard. So for
Sir?
Yeah, I can,
Sir, for question number 4, sir.
yeah, I can, nababasa ko naman. I
Okay.
also hear you.
Okay, sir.
So far, ayan. Can you hear me?
Yes, sir. Yes, sir.
Yeah. Naririnig ba ako?
Opo, sir.
Okay.
Tingin din kayo sa camera.
So, in my experience, yeah, in my experience, so far, so good naman, no? The interventions I made, sa solution focus kasi sometimes, it's, ano ba, hindi siya yung usual na approach mo na you try to diagnose and then not diagnose siguro, but you try to look for what is abnormal, kumbaga, and then you try to um, deal with what that abnormality is para bumalik siya sa yung normal, no? So, baliktad siya eh. It's really looking, it's a different perspective in the case na what's normal for the client should be um, their, kung ano yung perspective nila ng normality, yun yung magiging standard ninyo for what is normal. So, a lot of times, when you start with therapy in that perspective, may doubt talagang pumapasok kung magiging effective ba yung therapy mo or not. No? But, in my case, if you just really follow and stick to yung philosophy nun, and based on studies, ganun rin naman pagdating sa solution focus, you really have to really trust the process. I just to make it richer, no, I have asked some of my colleagues about this, about having a mistake or mismatch sa therapy na binigay nila or in terms may ganoong experience. Like for example, I believe you are familiar with cognitive behavioral therapy, no? Medyo ano yan siya, very technical, di ba? Sometimes,
Yes,
in cognitive behavioral therapy, hindi siya applicable pag yung client mo is may psychosis, so let's say may schizophrenia, especially for those na meron pa ring active ang kanilang mas may administer as an intervention. So, yun, may mga ganun talaga, may mga mismatch. So, kailangan mo talaga i-assess yung amenability nila, and then number two is if yung framework ng iyong intervention, sasabay rin sila.
Okay, sir. Maraming salamat, sir. For question number 5,
So
sir.
that's for question number 4.
Yes, sir. Thank you, sir. For question number 5, sir, describe a situation where you had to deal with a client who was reluctant to communicate their sentiments or emotions. What actions did you take to make them feel at ease in your presence?
So for question number 5, kasi pag yung client mo pumunta sa iyo for counseling, madalas hindi sila referred eh. They want to do counseling because they've been thinking about doing counseling already. And so madalas, they're already open and they consider having therapy. Pero I have a few sila. But bumabalik naman ako dun sa trust in the process eh, because if we're going to do an intervention na you have researched about and may trust ka doon, sometimes even if they appear to be guarded or reluctant, minsan, umaabot sa panahon na you would get to see them actually have progress. So there is once na I tried to do yung focus na therapy, and then at the end of our first session, talagang down ako kasi feeling ko hindi ko nabigay ang lahat, and I could feel na parang may mga things na hindi siya sigurado. But then upon our session, nagtatawag kasi ko rin siya, apparently, ginawa niya yung aking suggestion. And so, with that, I could say na even if your clients are reluctant and even if you have done things to make them more comfortable and you feel like they are not yet not responding or uninterested, minsan you just have to trust the process because at the end,
Okay, sir.
if they could be just trying to experiment. So again, it boils down to trusting the process and wants to do something else to deal with whatever they are dealing with.
6.
So that's for 5.
Yes, sir. Maraming salamat, sir.
So sa question number 6 naman po, how do you...
Thank you.
Thank you po. How do you approach understanding, analyzing, and evaluating the priority of a client's needs?
Okay. So for this one, pag may client ka or patient na dumating sa'yo, madalas, am I audible ba?
Yes, sir. Yes, sir. Happy.
6, madalas na when you have a client or a patient come to you, and alam nila na you're going to try an intervention or you're going to do interventions usually through counseling or psychotherapy. Madalas, when they try to open up to you, medyo scatterbrain ba, no? Or yung kanilang issues are here, there, and everywhere. Hindi po organized. So, as a psychologist, what I try to do is really to organize it. So, there are many ways to organize it. Pwedeng looking into which is easiest to handle them. Among these issues you have mentioned to me, alin yung mas madali? Or sometimes I ask, which one is more recent? So first, before ko ginagawa yan, I want to tackle first, I then ask them, what do you think would make sense na unahin? Of course, may mga things na inuuna talaga tayo. So if for example, they have issues with regard to let's say suicide, so that's one thing na kailangan i-intervene if they have thoughts of that. So you try to make a plan as to how they would deal if those suicidal intrusive thoughts are coming. So yun yung inuuna natin, yung mga things that may involve life and death.
Okay,
And
sir.
then next is yung underlying issues.
Thank you, sir.
Ano to? Pwede mo.
Accept mo.
Ano?
Hindi na kailangan kapag naka-join ka na, hindi na kailangan i-accept.
Okay na?
Okay, wait lang. Accept lang ako. Yan.
So let me just try to answer question 7.
Okay po. So, question number 7 po. What do you think are the most important methods of helping someone who is struggling with a psychological disorder?
Okay. So for someone who, for psychologists, no, pinaka-importanting galing with
Oh boy.
a psychological disorder is really empathy. So
Empathy.
I'm not sure kung anong year na tayo, no, but I believe you have heard of empathy. And sometimes kasi taking the time to understand and put yourself in the client's shoes is what boosts their vigor to get treated, to do better, and such. So, minsan, napansin ko nga in my practice, minsan, I could say that if you give it empathy and you really make them feel like that you are really listening to them and really making an effort to understand them. That's the first part of making a good intervention. Parang kumbaga para siyang 80 to 90% of the start. And then the rest, as a psychologist, you just have to kumbaga to push them kung saan nila gustong mapunta or with what direction they want to go. Ganoon. But empathy is number one. Yun talaga.
Okay, sir. Maraming salamat po.
That's
Question
for
number-
7.
Question number 8. Nakapatay.
Question number 8. What is the most severe condition you have treated and how did you deal with it?
Number 8. Wait ba yun? Pinag-quote lang.
So, usually sa akin, it's with bipolar na disorders and depressed na disorders. So, what I try to do is really what kind of intervention I'm going to give. Start with solution focus brief therapy because it's brief and research shows na it is effective for conditions such as those. Kaya lang, you have to also be open that it's not perfect. No, or cognitive behavioral therapy, if for example, yung treatment goals namin hindi namin meet through solution focused brief therapy. Yeah. So stick to your foundations.
Awesome.
It's really good that you train first and really get a hang of your of the approach you're going to give para you can make sure
For question number 9. Tama.
that's it for question 8.
Thank you, sir. Question number 9.
What are the nonverbal cues you look for during a counseling session?
So, okay. So during a counseling session, yung mga nonverbal cues na tinitingnan ko is first siguro yung mga marks of resistance, yung mga what you think about when yung mga what you see pag yung tao resistance. So for example, yung crossed arms or crossed legs, yung mga other nonverbal cues siguro yung frowning, no? Yeah, so when you see that they are doing that, then you have to be sensitive to what they're trying to say. Like for example, maybe they're saying that they're not comfortable yet to go the lead, or maybe your questions might be intrusive for them. So pag ganyan, minsan kailangan mong ibigay, kumbaga if you're driving, you have to give the wheel to them and see kung saan sila para you can meet eye to eye. Another thing is yung eye contact. Minsan sa eye contact, you can see if they are shy or if they are really engaged, really trying to listen to you. Yan mga common nonverbal cues that I try to look for during the counseling
Okay, sir.
session.
Maraming salamat, sir, for the last question.
For question number 10, sir. For you, what is the most essential skills and or attitude in being clinical psychologist? Thank you, sir.
Okay. Siguro most essential skill, having empathy.
Maraming salamat, sir.
Really. Kung wala kang empathy, it is impossible to even imagine how to provide intervention sa iyong patients and clients, especially for those with clinical disorders. No? So kung that's a very very essential skill. For attitude, siguro patience. It's really important to be patient because a lot of times if we're talking to our friends or colleagues, so we get frustrated kasi what you're trying to say, hindi na naiintindihan. So, friends na, what you're trying to say, uh, that it would come across that they would understand it, on
Yes,
so
sir.
yan, patience and maybe communication.
Thank you, sir. Yes, sir.
So that's all for
So
today
that's
po,
for
sir.
question 10.
Yes po. Thank you so much po, sir, for sharing your knowledge to us po.
We really appreciate po your presence, sir.
Thank you so much.
Thank you so much, sir.
Thank you
Tas,
so much.
maraming salamat po.
Yeah.
Selfie mo tayo, sir.
Sir,
Screenshot lang.
Sir, pwede po screenshot ng picture.
Thank you, Lynn. I really appreciate you asked from me, and